us for today's webinar, Driving Efficiency Across Your Practice. We're so glad all of you could join us, and sincere thanks to the Iowa MGMA for hosting this presentation. My name is Sarah DiNardo, and I'm the Senior Director of Client Services at Phreesia, a software-as-a-service company that automates the patient intake process. In my role at Phreesia, I lead a team focused on implementation, account management, and optimization for large and complex organizations, and I'll be the moderator for this webinar. Today, we're going to be talking about administrative waste and inefficiency in healthcare, a problem I'm sure many of you listening on the line are probably very familiar with. Inefficiencies in medical practices can lead to wasted time and resources, and they can also reduce productivity and throughput, hurt the bottom line, contribute to errors, negatively impact the patient experience, and lead to frustration and burnout for staff and physicians. We'll be covering some of the most common sources of inefficiency in medical practices today, and we'll be discussing best practices that can help address each one of these pain points. We're also very fortunate to have Katila Farley with us today to share her firsthand experiences with identifying waste and inefficient processes and addressing them with the help of technology. Katila is a registered nurse and the Birmingham Market Operations Director of Birmingham Internal Medicine Associates, a physician-owned practice in the suburbs of Birmingham, Alabama. Before we get started, just a few brief words about Phreesia. We're so excited about participating in this webinar because the topic aligns so well with our mission and priorities. As you can see, here are a few data points that illustrate the size and scale of our network. We manage more than 54 million patient intakes each year, and we were named the 2019 class category leader in patient intake management. Here you can see our different categories of applications and features. Phreesia is designed to be a customizable solution that helps our clients meet their own unique goals, whether that's streamlining the registration process with mobile check-in, verifying eligibility and benefits, or giving patients flexible payment options such as card on file and online payments. Finally, as you can see on this slide, the Phreesia platform includes several different modalities. Our mobile application that allows patients to check in before their visit or when they arrive, the Phreesia Pad and the arrival station that patients also use, and the staff-facing Phreesia dashboard. We all know that inefficiency in healthcare is a big problem, but how big is it? You may have seen this headline from earlier this month. It's about an article that appeared in JAMA on October 7th that was widely covered in the media. The study's authors found that the waste in the US healthcare system accounts for about 20 to 25% of spending, or a staggering $760 to $935 billion annually. That's a stunning figure, nearly $1 trillion on the high end. There have been plenty of studies that discuss the problem of waste in healthcare, but this latest study had the highest estimates so far. Given that healthcare spending in the US is roughly 18% of our economy, it makes sense that these numbers are very large. According to the study, some of the biggest sources of that waste are administrative complexity, overtreatment, fragmented care, and fraud and abuse. And of course, those span all treatment settings and specialties. Today, we're going to focus on the first one, administrative waste, in the context of medical practices. According to the US Department of Labor, there are more than 1.2 million people working as patient intake staff in medical practices across the country. And that number is growing. As I'm sure many of you have experienced, practices are being asked to do more with less. That ever-growing list of tasks includes managing increasing patient financial responsibility, complying with new guidelines and regulations, and participating in value-based care programs. Meanwhile, this is a tremendous pressure to make sure you're providing a high-quality patient experience. For any organizations, Managing that growing list of duties has meant hiring more people. Unfortunately, that often means a greater number of people working within inefficient processes, instead of actually addressing those inefficient processes. And for those intake staff, it often means a lot of manual, time-consuming tasks, such as scanning and checking insurance company websites without much time to focus on patients. So let's talk about some of those inefficiencies. Those common pain points that I'm sure many, if not most of you, are familiar with in your own practices. First, we have appointments. Appointment scheduling is one of the most central processes in a medical practice. If patients have trouble making appointments, they won't be able to access care, and the organization will be unable to grow and achieve its mission. But what we know about this process is it is often very challenging for patients, even as they're increasingly looking for convenience and flexibility. Making an appointment often requires making a phone call, sitting on hold, and waiting. Sometimes that can be for a long time. In 2018, Phreesia surveyed more than 14,000 patients across its network to learn about their preferences and expectations for the appointments and referral processes. When the patients were asked how long they typically had to wait when scheduling a medical appointment over the phone, 16% said they were on hold between 2 and 5 minutes, and 7% said they typically waited on hold for more than 5 minutes. In other words, nearly a quarter of patients reported that their typical hold time was over 2 minutes. That's a concerning data point, considering long hold times and possible hangups not only negatively impact the patient experience, but they can also impact revenue, patient retention, online reviews, and word-of-mouth referrals. Speaking of referrals, that's another source of inefficiency in many practices. The referrals process is often characterized by multiple calls, long lead times, and confusion for patients, and by time-consuming manual tasks and fragmented communication for providers. Referring patients to other providers for tests, consultations, or additional treatments is one of the most common processes in healthcare. They're an important way to ensure patients get appropriate coordinated care, and they're also a key source of new patients and practice revenue for specialists. Referrals are made in nearly 1 in 10 ambulatory appointments in the United States, resulting in 100 million referrals each year. As I'm sure all of you know too well, handing a patient a slip of paper doesn't necessarily mean that a visit will occur. According to a joint report released in 2018 by the Institute for Healthcare Improvement and the National Patient Safety Foundation, up to 50% of referrals aren't completed, which can lead to missed or delayed diagnoses and delayed treatment. We're going to talk later about some of the reasons why patients don't follow through on referrals, as well as best practices to improve their referral process. Verifying eligibility and benefits often takes a ton of staff time and requires a lot of inefficient manual processes, including phone calls and checks on insurance websites. This slows down the check-in process as staff work to check whether a patient's insurance has expired or whether they have secondary insurance. Hurried staff might not get to those checks each time, which can lead to claims being rejected because of eligibility. Manual entry of insurance information can also introduce errors, which can lead to denied claims. If you're struggling with patients not showing up for their appointments, you're definitely not alone. According to industry data, no-show rates in most practices are between 5 and 10%, but that rate can be 20% or higher in some organizations. Patient no-show affects organizations of all sizes and specialties, and they cost the healthcare system billions of dollars each year. They waste staff time and resources and leave patients without necessary care, making it harder for medical practices to achieve their broader goal of improving patient outcomes. As with all of these pain points, we're going to talk a little bit later in the presentation about some best practices to address them in your own organization. As I'm sure all of you know, wait times is a big one. Long wait times are one of the clearest signs of inefficient processes and dysfunction in a practice. And those bottlenecks have a big impact on patient experience and retention. A 2016 study in the Journal of Medical Practice Management found that 96% of patients' online complaints were related to service issues like long wait times and distracted staff. Backed up schedules and long wait times are frustrating for patients. They're overwhelming for staff, they hurt revenue, and they are definitely a detractor from provider satisfaction as well. But in a lot of practices, wait times might be the norm, so it's often hard to look objectively at the issue and think about how to make those inefficiencies better. One of the most enduring images people have in their mind when they think of inefficiency in medical practice is a clipboard stack of intake forms that patients are handed when they arrive. Those forms require patients to provide their demographic information, update medical history, social history, sign consent, often using redundant and non-specific questions. Then staff must complete data entry and scanning, all while trying to balance with their other tasks. These processes lead to errors, long wait times, poor patient experience, and staff burnout. Not surprisingly, the payments process is a big source of inefficiency in many healthcare organizations. As all of you know, patient financial responsibility continues to rise. According to a Kaiser Family Foundation study from earlier this year, nearly 30% of American adult workers are now covered under a high deductible health plan. Of course, that means that the more and more of your revenue now comes from patients, but the processes in many practices have not caught up with that reality. That means in many organizations, there might not be a financial policy that is clearly communicated to patients, or staff aren't collecting payments at the time of service because they're not comfortable asking. That means billing and collecting after the visit, which is costly and often takes a lot of time. On average, it takes more than 3 statements costing $5 to $15 each to collect one patient's balance in full. Finally, we have clinical data. Many practices ask clinical questions on their intake forms, only to have clinicians ask the same questions during the encounter, using a significant chunk of their short visit on data entry. So now let's talk about some of the ways to address each of these pain points. First, the appointments process. As I mentioned earlier, Phreesia surveyed more than 14,000 patients last year about their preferences and habits related to making appointments. What we found is that a growing number of patients prefer scheduling appointments online at a time and place that works best for them. As you can see in this chart, the percentage of patients who preferred online appointment scheduling was higher among younger patient groups and slightly lower among those 65 and older. But that doesn't mean older adults won't schedule appointments online. Offering patients the ability to schedule appointments online reduces inbound and outbound calls, saves staff time, and gives patients a more convenient experience. Offering the ability to schedule appointments online is just one way to improve the appointments process. Appointment reminders are also a great tactic. In the survey I just mentioned, we asked patients how they prefer to be reminded of upcoming appointments. 48% of respondents said they preferred text message reminders. That's compared with 29% who said they prefer a phone call and 21% who prefer an email reminder. The percentage of patients who prefer text message reminders hovered close to the 50% mark across all age groups. Next, the referrals process. Understanding why patients don't follow through on referrals is crucial to addressing that pain point. When we asked patients that exact question, they cited a mix of factors. 22% said it was because they felt better, 14% said they forgot, Another 14% said they went to a different healthcare provider. 13% said the cost was too high, and 6% said they were confused about what to do. That mix of responses may seem overwhelming, but it actually provides a nice guide for some best practices. It's important to make sure the referrals process is convenient and easy for patients to understand. And since many patients cited cost as a reason for not following through on referrals, being transparent about estimated costs is a great way to give patients the information they need to manage their care. Finally, leveraging automated appointment reminders can help to address the issue of patients who simply forget to follow through on their referrals. Next, we have eligibility and benefits. As I said earlier, this is a significant source of staff workload in many medical practices, as I'm sure all of you know. It also contributes to staff burnout. Encouraging staff to check patients' insurance in advance can be an important time saver, but it's not always feasible in busy practices where staff are already stretched very thin. Implementing real-time eligibility and benefits verification can streamline the process by ensuring those eligibility and benefit checks happen every time. That means less manual workload for staff, fewer pending and denied claims, and faster reimbursement. Next up, we have no-shows. Patients don't show up for their appointments for a variety of reasons, but as you can see here, there are some best practices to keep no-show rates down. First, schedule efficiently and streamline the intake process. Patients are more likely to forget a missed appointment if they are forced to wait several weeks or even months to be seen. Try to schedule patients as soon as possible, especially new ones and those with urgent needs. In addition, keep patient wait time short by encouraging patients to check in ahead of time so they won't need to spend time filling out paperwork in the office. An organized, streamlined approach to scheduling helps build patient loyalty, boost satisfaction, and reduce no-show appointments, because when patients see that you value their time, they are more likely to value yours. Next, analyze your appointment data, including no-show rates, so you can see what's causing them in the first place. Frank Cohen, a consultant and expert in lean process improvement, suggests measuring the lead time from scheduling to the actual appointment and examining whether that affects the likelihood of a no-show. You can also analyze no-show rates by provider, by patient type, by day of the week, by payer, or whichever variable you choose. Once you identify patterns, you can then make adjustments accordingly. Automated appointment reminders are also a quick way to engage with patients before their visit and prevent no-shows, especially if those reminders include a link that allows the patient to check in before their visit. Automated reminders also streamline operations and free up staff time previously spent trying to fill last-minute schedule gaps. Offering the option to schedule appointments online is a great alternative to requiring patients to call and possibly wait on hold and potentially hang up. According to a study from Accenture, while it can take up to 8 minutes to schedule an appointment by phone, it takes 1 minute on average to book one online. Online scheduling offers patients more freedom to choose their preferred appointment time and increase the likelihood that they'll keep their appointment. Finally, make sure you communicate your no-show policy clearly. All of you on the line today know that no-shows add to staff stress, they leave holes in your schedule, and hurt your bottom line. It's important to make patients aware of both the consequences that no-shows can have on their care and the impact they have on your practice. Create a patient no-show policy that patients read and sign before their first appointment that briefly and clearly explains the problems caused by no-shows and how you handle them. Include a brief explanation of fees charged for missed appointments, the number of no-shows allowed by your organization, and your requested notification window for cancellations. Make sure staff are also well informed about the policy and encourage them to use it as an opportunity to educate patients. As I discussed earlier, long wait times are often a sign of inefficient processes in a medical practice. A 2017 MGMA survey found that the average wait time in medical practices was 20 minutes. So what can you do to bring down wait times? First, this is an area where technology can really help. By automating many of the processes related to registration, you can reduce the amount of time it takes patients to check in, and you can improve throughput. One of the best ways to do this is by giving patients the option to check in before their visit. Looking for waste and redundancy in the intake process can also reduce wait times, especially if patients are answering the same questions over and over again, or answering questions that aren't relevant to them. Next, it's a good idea to take a look at your data and make sure you understand your schedule. When are those bottlenecks occurring, and what concrete steps could you be taking to address them? It might be a good idea to add additional hours to accommodate patient scheduling needs. Finally, it's important to make sure staff clearly communicate expected wait times to patients. Several studies have shown that while wait times have a huge impact on the patient experience, perception of those wait times matters even more. If you're running behind, make sure staff know to be extra attentive to patients and tell them when they can expect to be seen. Our next pain point is forms and consents. Managing paper forms takes up a tremendous amount of staff time, as does determining which patients are due for which consents and releases on which dates. So how can you make this process better? First, by moving data collections before the visit wherever possible. That includes gathering demographic information, medical and social history, and consent. Technology obviously plays a key role in making that possible. Additionally, it is a good idea to look at your interviews and make sure you're asking the appropriate questions of the right patients and looking for ways to reduce redundancies. And finally, you can use reminders to make sure you're collecting consents from patients when they're due, or you can automate the process to be sure they're always up to date. Next, we have payments. As we talked about earlier, patient financial responsibility continues to grow. According to a recent study, patients' out-of-pocket costs jumped 14% from 2017 to 2018. The good news is that there are effective ways to improve your payment processes, help patients manage their financial responsibility, and put your healthcare organization on more solid financial footing. The first one, without a doubt, to prioritize is time of service payments. Moving payments from the front end and adjusting patients' expectations to work within those new processes increases revenue, reduces bad debt, and saves patients from surprise bills later on. Having an easy-to-understand financial policy is necessary to make time of service collections work successfully. Historically, patients have faced confusion and uncertainty about their medical bills and their expected costs of care. Clearly communicating your policy addresses that uncertainty head-on and helps patients understand what will be expected of them and what their options are. Speaking of options, consider offering flexible, convenient payment options, such as the ability to put a card on file, the ability to pay online, or the ability to set up a payment plan that meets your patient's needs. These payment options help you get paid, and they also meet your patients where they are and give them the flexibility they need. Next, be transparent about patients' estimated costs. We recently surveyed patients from across Phreesia's network about their healthcare costs. The vast majority said they wanted to be able to plan for the regular costs of their medical care just as they plan for other expenses, but they lack the information to do so. Being transparent about price gives patients a better financial experience, and it also helps boost collections. Finally, use data to track your progress. Our final pain point is collecting clinical data. In many practices, patients answer clinical questions during intake to only answer them all over again when they see their provider. This is another great opportunity to leverage technology to make sure you collect this data once and ensure it gets saved in the patient's medical records so the clinician does not have to enter it again. Additionally, having patient-reported data accessible during the visit can make short visits much more productive and meaningful. For instance, if a patient is feeling depressed or if they're in pain, having access to that data in real time makes it much easier to address patients' needs. Finally, keep in mind that your efforts to improve efficiency might make administrative staff worried or concerned. It's very important to reassure staff that efforts to reduce waste and inefficiency in your practice are intended to take manual, time-consuming tasks off their plates and give them the time to really focus on patients. It might help to explain that you see them as ambassadors of the patient experience, because they are that critical first touch point with the patient and they set the tone for that visit. As I touched on earlier, the vast majority of patients' online complaints about medical practices are about service-related issues like poor staff communication and wait times. So make sure staff understand their role in making that experience great. Make sure you also engage your staff early on in any improvement initiatives and seek their feedback often. And finally, consider friendly competitions to engage staff and boost buy-in. For instance, 2 locations of a practice might compete to see which one can reduce check-in times or collect the most copays. Prizes don't have to be large. In many cases, a nominal gesture such as pizza for lunch is enough to get everyone excited and on board. I realize I've covered a lot of ground quickly, but I hope this was helpful. Now I want to turn it over to Katila Farley, the Birmingham Market Operations Director of Birmingham Internal Medicine Associates. Katila?
Hi, Sarah. It's Jean. I'm trying to get her unmuted here.
Okay, great.
Katila, if you can hit your unmute on the GoToMeeting. Another option here.
Yeah, she has the easiest schedule.
Hi there, are you guys hearing me now?
We are.
Yes, thank you. Fantastic. So hello, MGMA members and visitors. Sorry for that little technical glitch, it happened. So again, my name is Katila Farley. As introduced, I have been with BEMA for almost 10 years. I started off really just with accounts payable and handling some credentialing, slowly took over the role of billing manager. Back then we were with an EMR that we are no longer with called Greenway. So it's important that you guys understand I've had familiarity with a couple different EMRs. For the past 6 years, I have been the administrator for this internal medicine and family medicine practice. I'm a registered nurse, and I have complete intention in keeping the patient first. That is my goal in how we lead the practice. And this year, we are really excited. We merged with an independent primary care network called Complete Health. And if you're interested in learning about them, it is www.completehealth.com. And they asked me to take on a brand new role, and I will be the Metro Birmingham Operations Director, or I should say I am that, where I will be working with other practices to create a nationwide primary care network. And I'm beyond excited to be joining this call today. So as you see on the screen, we have one location that we practice medicine, and we have a secondary location called our corporate location that houses all of our central phones, our billers, our quality department to include transitional care, chronic care management, We have 9 physicians and 9 nurse practitioners, and they are a blend of family care and internal medicine. Our average daily check-in is 172, but we have days we see upwards 230, 240 check-ins. And I think it's a really good moment to call out. We're able to do that with 4 receptionists. So we are extremely advanced when it comes to technology. Our electronic medical record we use right now is called Athena, and then we have the sign-in system Frisia that we use. And in combination with those 2 incredible systems, we are able to be extremely efficient. Actually, in 2017, Blue Cross voted us as their most technical practice here in the great state of Alabama. So we are really proud to hold that honor. And I think it's important for practices to understand that when you represent yourself as being technically advanced, your patients immediately perceive a practice that is trustworthy and efficient. And we're really happy to say that we are that, even without just a perception. So I'd like to move on now and talk about some of our inefficiency challenges. And I wanted to focus on, challenges that all practices face. From phone volume to regulations placed on practices, creating burdens on practitioners. We have practitioner burnout we're fighting through. And on this slide, I simply listed, our top 6 challenges we've faced and that I face as the administrator of this practice. And, you've just heard a really impressive conversation about wait time. And, if you really take a look and really step back, a true patient experience killer can be your wait time. And it's really, really good to get creative with your wait time. I mean, think about what Disney's done. I mean, they've created a world in the wait. 80% of your time in a Disney park, you're either waiting or you're walking to the next waiting. So take that into account and really think about what you can do with that wait time. What are some of the things you can do to make use of this time? How can you market your practice? Is everything in your reception driving conversations, everything that you guys have to offer? And think about ways to create patient engagement during this time, because that's very important. We've got to get patients to have as much of a burden on what they can do for offices as we take the time to figure out how to make their experience better. Redundant data entry. So forms lead to data entry. They lead to scanning. They cost money to print. You then have to shred them. You have additional HIPAA barriers. And to offer the best experience for your patients, you want to partner with an electronic medical record and a registration product and try to remove that burden, not only off your staff, but off your patients, giving them the ability. I mean, just think about it. Years ago, how many people would call a phone number to book a flight? And now everything is done electronic. And why should healthcare be behind? And being able to track consent forms. I mean, that's just a completely additional level of burden and technology. And there's just ways that technology can alleviate that burden. And if we talk further about data entry, you have the opportunity for errors to occur because perhaps you can't read the handwriting, or transposing the information from one form to the computer system is occurring. We've even worked hard to remove this in the clinic, such as point of care testing automatically uploading into a medical record instead of staff having to hand providers slips of paper and then running back to the computer and trying to get that in. There's so much efficiency that can be had in technology and reduction in errors. And those errors can mean patient safety. So when you talk with your providers about new opportunities, as long as you're talking to them about ways to ease their burden or to reduce patient error, a provider will always listen. High phone call volume. Our practice experienced massive reduction in our phone volume because we have 91% of our patients on the portal. And guys, that's not easily done. That takes work, but it can be accomplished. And it starts at the schedulers and it's driven throughout clinic. And the more engaged your patients are through their portal, the less they're having to call in. And honestly, the more engaged the providers are with the patients directly, and you just create this collaboration of care that is really incredible and life-altering for patients. Overburdened staff. When we launched our technology, the staff were fearful. I tell practices all the time, you will still need your team. They will simply have more time to look up and smile, look in the eyes of your patients, have conversations, know your patients. You will increase both customer service and the patient experience with this time, and they can work one-on-one with patients and truly impact their care and that patient's experience. And then just running the treadmill, constantly trying to play catch-up between new regulations, insurance changes, new insurance cards, new Medicare cards, ABNs, pre-certs. When you look and focus on the patient, when do you have time to focus on the patient if you're so busy worrying about all of that? Do I need to get a new HIPAA form? Does this procedure require something? So let's move on to BIMA's three-pronged strategy and how we've been able to get there. And it starts with the patient. How do you engage them? Especially at different stages of life. I mean, we take care, some of our doctors are double board certified in hospice and palliative medicine. We have a lot of Medicare patients. We have younger patients. And you have to be able to engage them at what speaks to them. And in order to see true impact, they have to buy in and they have to take personal responsibility. And this is a culture shift, and it is not easily done. And it starts with the provider. And so how many of us have sat down with our providers and talked with them about how we can help them? And when you talk to your providers, if you're talking to them in a way that we are a resource, that there is a change, but it's a resource, they're gonna listen to you. Change management and medicine is tough. Providers are autonomous. They are the hardest working people I know. And the struggle is trying to make a change for the better, but it's still a change. And the most successful you will be is when they are on board. And then lastly, if providers are on board, then you're going to organically create a culture of staff buy-in, especially if you approach the staff and incentivize them specific to what you're trying to do. And again, none of this can happen without the right partners and the right technology. And sometimes the best way to speed up is to actually slow down, catch your breath, find the wind so that you can set sail. And that only happens through the right partners and the right technology. So lastly, let's go ahead and talk about how we've done this and talk about tracking. I mentioned aligning incentives across your practice. And I think it's very important that we talk for a second about before you do anything, you should start with your mission and your vision. And everything you do should align to your mission and vision. And if you're trying to decide something, if you go back to your mission and vision and it doesn't match, you shouldn't do it. And so pull out your mission and vision and start there. And then your incentives should narrow and they should be measurable because you can't win unless you can track the wins. So if you decide to make a change, start with steps that will be needed to make the change. Small steps, not the whole change, just one step at a time. And then align every single staff member, whether you do it through incentives, maybe you do it through goals, you can do performance reviews, But overall, every single person in your entire practice should have alignment. And remember, you must start at the top and work backwards. Providers, they need us to support them. Every person should work to the top of their license. And when deciding if you should do something, make sure it aligns with your mission. So we at BEMA have a quarterly bonus opportunity, and we tie our net promoter score. We tie our portal adoption. And there's other parts to it, but most recently we've added a quality and coding benchmark. Everyone from medical records to phone, every clinic personnel has individual goals as well as team goals, because we need to create teamwork, because only together can we meet our objectives while staying on course to keep caring for our patients, our calling, and to keep patients first. So I just wanted to take this opportunity to say thank you for allowing me to feed in to you, to encourage you, and to let you know it can be done. I know I've talked to practices across our state. I attend our local MGMA. I talk with a lot of different practices, and I know that markets are different and doctors are different, but if we can all step back and understand that just because it hasn't been done doesn't mean it can't be done. And let's energize and inspire and motivate. And you can see change not as a negative, but as an opportunity. With that, Sarah, I'll let you take it back, and please let me know what else I can do.
Sounds good. Just a reminder to anyone, if you have any questions, post them in the chat. I am going to get started with one of the questions that has come in. So the question was, we have an older patient population and we're worried about their level of comfort with technology. Do you have any advice? Katila, do you want to answer that one first, and then I can add a couple pieces?
Absolutely. So we actually, I sat back one day, and I'm a big, let's try to think out of the box, right? Let's try to figure this out. And so once upon a time, there were gas stations, and there was people that came out and pumped your gas and took your cash. And so we've seen people, especially when you start looking at the older population, how did they transition? And I sat back one day and I said, wait a minute, they pay at the pump. Well, if they can pay at the pump, this concept isn't too much different. And so the more I took a look at it, it's actually easier for them, because with Freesia, for example, every question they ask is gender specific, and you have decided they're only going to get one question at a time. And so if we can actually simplify it, give them the ability to have bigger font, and also free your staff up to have the opportunity for anyone who is struggling to one-on-one with them, there is no loss here. And so that's how we were able to do it. And I will say one more thing about this concept, guys, is if you decide to do it, go all in. Don't try a hybrid model, because it just doesn't work. It's confusing. Some people will want to do it, some people won't. So that's my advice to you. We have lots of Medicare, lots of elderly. I have 94-year-olds that can do this. So that would be my answer. And please join in and add anything else you'd like.
Yeah, I would say the other thing that I would like to add is, with Freesia, the technology component can be done ahead of patients coming into the office. And a lot of the elderly population is very comfortable with using their computer at home. So we see a lot of them trending towards using their computer, which they're on, to share pictures with families or emailing. So that really does seem like a natural way for them to transition into the technology. Another question came in, and this is for Katila specifically. How did you decide which sources of inefficiency to focus on first?
I started off by imagining the patient experience and the reduction of the barrier of care. And then I worked from there. And I we have this wonderful, incredible thing that we did called a patient advisory board. We sent out to all of our providers, hey, give us 3 patient names for this focus group we're going to put together. And they were incredible. And to this day, if I am considering something, I want to hear about what the patients think about it. So I would recommend that. We worked really hard to become a patient medical home through the NCQA, and that was a year-long process. It wasn't easy, but what we learned from it was inefficiencies, barriers, and how to have excellence. And then I took a look at, the Disneys of the world and what do I enjoy about a really great hotel. And then I tried to embed that into what we now think of as retail medicine, because patients have choices. And if you want to be the premium, the go-to, then you just have to be willing to adjust to that. And some of those adjustments were actually really small. Like with Frisia, we didn't remove any staff. We didn't, make any changes in that way. We reassigned and we reorganized, and it has been nothing but incredible for us.
Great, thanks, Katila. I know we touched on this one a little bit already, but just to circle back to it, a specific question came in on our staff is very resistant to change, especially new technology. Can you give some specific examples of how to get them on board? And I'll just answer this first quickly, and Katila, then you can add in. From a technology implementation perspective, there's a couple of things that we really focus on and that we found to make the adoption better. And the 2 pieces are, the first one is just communication, educating staff early. And then the second piece is involving them in the process. So as soon as they're involved in the process, and that is, the people that the technology is directly going to impact, and then also anyone else in the office that is going to, be impacted by it in a secondary manner, when they're involved in the process, they instantly become more engaged and more bought into it as we work through different design decisions and different workflow consultations throughout the process. Did you want to add anything there, Katila?
I think you hit it perfectly. I would say reduce the fear. And you do that by engaging them, making sure their buy-in is heard, and then giving them some projects that they assume and run with and trust them. I think the hardest part about leading practices is we have so much ownership in every decision we make. But if you are growing your teams and you're growing your leaders, when you start trusting them and depending on them, it's going to naturally progress and you're all going to push forward together. And so just reduce the fear and open up for some trust, and you'll be really amazed at how well that will work for you.
Another question came in that kind of expands on that one. So for specific scenarios where you've done that, how did you engage the staff and get them to give their feedback? I know you just mentioned, giving them a part of the project. Was that through discussion and collaboration with them?
Absolutely. So we have weekly huddles. Again, a lot of this came from our goal of becoming a medical home. But, absolutely, at any time, if I start looking at a product, and we are always, I am begging for more and more products, because I want a beta, I want to alpha test everything, because we have got to stay right up there with the Amazons of the world, right? And so I go directly to the group that it would most quickly impact, and I get their buy-in, and they help me make the decisions. And I know it's busy and it's hard to do, and sometimes you have to do it during lunch, or maybe this has to be a 15-minute call because we don't have time. But again, that's what I was talking about. Sometimes you have to slow down a minute so that you can double and triple your speed. Since launching Frisia, I remember when we first launched, we had 6 doctors and 1 nurse practitioner. We now have 18. I can onboard a new doctor so quickly because they no longer have brand new face sheets. Freesia creates a full patient face sheet for our providers. So when I'm recruiting new doctors, I can say to them, I can impact your clinical. Freesia's great on the front end, but let's talk about what it can do on the clinic side. And so what I would say is engage different people, have different focus groups, but especially reach out to a few of your patients. I mean, what do they think? And get them on board. And then they will be your billboards and your staff will go right along with you.
Fantastic. Thank you. All right. We have another question around how can we prepare patients for us starting to focus on time-based service collections, since in our organization, patients are not used to us doing that up front. Jayla, do you want to take the first pass?
I'm happy to do that. So anytime you have a culture change, you have to approach it in steps. So what I would do is I would break that project up. What do we want to do phase 1, phase 2, and phase 3? More than likely, you want to start creating conversation around it to start, and then say in the next month or 2 months, this is what we're going to be doing, and get it out there to them. If you have a really robust EMR, you can do that through a blast message. Hey, this is what's going to be going on in the next 4 to 6 weeks. This is what's coming. We're super excited about it. Here's the resources you're going to get. This is what your doctor is this is going to motivate and take him to this next level, and just phase it. And as long as you phase it, you'll be perfectly fine. If it's just all of a sudden, hey, this is a new way we're doing it, you're going to get pushback. So I think as long as you do that and you hold to it, you'll be perfectly fine and it won't be an issue for you. But honestly, if you take a look at your insurance contracts, most of them require that you do collect a certain portion or minimum. And so what we did in our office was we did phases, but then we also said, hey, X insurance company now requires us to do this. And we took some of the burden off of our practice and placed it on the regulations. And that is also very helpful as well.
One additional thing I'd like to add is definitely agree with breaking it up into phases. And I think we also covered some of the flexible payment options during the discussion. And those are, just a huge benefit to patients who might be feeling that pressure when it is an initial change, knowing that, paying some amount up front and spreading the rest over upcoming months, or even storing their card on file for future payments, can really address the different needs. A question that also came in is, you mentioned gathering patient-reported outcomes during intake. Can you tell me more about what you mean and why it's beneficial? So a couple of the things we've really seen around this and how it can be beneficial is, firstly, it really allows the clinical staff time to spend focused on the patient when they have the patient in the room, especially at very, high throughput practices. The patient may not really have a lot of face time with the provider, and this allows that data collection to happen up front and get it into the right spot for the care team, so that when that MA and nurse is triaging the patient, they have all of the data at their fingertips and they're not spending time typing things into the computer. Additionally, when the provider goes into the room, they know it's already been reviewed and they're able to, again, look for the information where they expect to see it and have meaningful conversations with patients. The second thing around this is around just honesty with the technology. So some questions around depression or falls risk or other things that can be somewhat sensitive topics to patients, we've found that they feel a lot more comfortable answering those questions truthfully to technology rather than the uncomfort that they feel when having a face-to-face conversation to answer those questions. So allowing the technology to ask those questions, the patients to have a very private setting to answer them, and then again, going into that care visit with the information already teed up. Katila, do you want to add anything around the clinical piece.
I just 100% couldn't agree more. And the really great thing about that with Phreesia is you have all those documents saved, and you're not having to then go back and scan them in. And depending on which electronic medical record you have, it will likely drop right into that system. Our system, it even tees up the billing code for us. So we're able, we've actually created a performance around all of our annual wellness visits to have 3 required, if Phreesia does this for us, to have 3 required forms that are automatically done by patients when they're checking in. So, you know, we have patients, I want to say we have 36% of our patients who actually present to our office. They are completely checked in. They've already filled out all their assessments, and they sign in, and the clinic staff pulls them back. And then that then frees up for those patients that haven't done it. They get one-on-one. They get a little bit more time with that front desk because there's not so much pressure. And so if you can achieve clinical excellence at the same time achieving really great reception moments, it's a win-win. And again, it's a complete excellence moment for the patient.
All right, great. Well, I want to say thank you to Katila Farley for joining us, and thank you to the Iowa MGMA, and thank you to everyone on the line. I'm going to turn it back over to Jean to close it out here.
Thank you both for and to all the participants for attending today. I do have one more question that came in asking which EMRs have proven interfaces with Phreesia, and specifically is NextGen on that list?
Great question. Sure. So NextGen is on that list. Definitely. We have partnership integrations with Athena, NextGen, Greenway, what was previously GE Healthcare, now part of Athena, Allscript. We have a partnership with Epic as well, and we also do offer HL7 integration. So we work with other systems that I may not have listed where we can support HL7 integrations as well, including Cerner.
Great. Thank you for that. And please watch your emails from your respective states for the next webinar. We will be sending out the follow-up survey that will go out, and the webinar has been recorded, so that will be posted on the respective states after the webinar. We appreciate everybody's time, and we look forward to seeing you on the next webinar.